Today I will be demonstrating how to do an intradermal injection. So the first thing I did is gathered all of my supplies. I have gloves, a gauze pad, an alcohol pad, my tuberculin PPD solution, and a needle that's a 25 gauge by 5/8 of an inch. While I'm doing this, I'm going to make sure to adhere to the 6 rights of medication administration, which is the right patient, right medication, right dose, right time, right route, and right documentation. So I'm going to compare the MAR to what I have. The MAR says 0.1 milliliters of tuberculin PPD, and I have 0.1 milliliters of tuberculin PPD. So now that I have everything together, I'm going to go ahead and take this to the patient's room. I'm going to close the privacy curtain to provide privacy. Hi, my name is Sarah. I'll be your nurse today. Can you tell me your name and date of birth? And that matches what I have on the MAR. Do you have any allergies? Any allergies to medications, food, seasonal allergies, anything like that? Okay, no allergies noted. I'm here to give you a TB test, so I'm just going to inject a little bit of fluid underneath the first layer of your skin. It'll swell up a little bit like a mosquito bite, and it should dissipate within the next couple hours. If it's not resolved within the next 3 days, then we have a problem. And if it's okay, there will be a slight burning or stinging sensation when I inject it, but anything other than that, bleeding, blistering, scabbing, if that injection spot gets hard, we need you to notify us as soon as possible because that's not normal. Do you have any questions for me before I do this? Okay. I'm going to perform hand hygiene and put on my gloves. I'm going to check my medication one more time against the MAR. The MAR says 0.1 milliliters of tuberculin PPD. So I have tuberculin PPD 0.1. So I'm going to get my needle out. I'm going to intake as much medication as I need. I'm going to take that much air in, so that's going to be 0.1. And I'm going to inject, oh, this is not sterile. Before I did that, I would have cleaned the top of this, so I'm using aseptic technique. And then inject the 0.1 and withdraw 0.1 of the medication. Okay, so now that I have that up in my 25 gauge 5/8 of an inch needle, I'm going to inject it into their skin. But first thing I'm going to do is clean the site with the alcohol swab. So the site, I want it to be about in the middle of the arm. So right here, I'm going to start swabbing in the middle, working my way out, not touching the middle again. I'm going to wait for that to completely dry. Checking my medication for any air bubbles. Okay, now that that's dry, I'm going to go ahead and apply this. Bevel side up at about a 5 to 15 degree until I get to resistance. And I notice a bleb forming there. Do you want a Band-Aid? No? Okay. So I'm going to go ahead and dispose of my needle in a sharps container. And I am going to take off my gloves, wash my hands, and document my findings.